For more than a month, Shane Anthony, a 57-year-old auto mechanic, hasn't been able to get his diabetes medication. Ozempic, an injection that keeps blood sugar levels in check for patients with type 2 diabetes, has been in shortage for about 4 months, according to the database maintained by the U.S. Food and Drug Administration, and is backordered at Anthony's Seattle pharmacy. Without the Novo Nordisk A's prescription, he has suffered recurring dizzy spells while repairing cars. Alternative medications are either out of stock or not covered by his insurance. While increased demand and supply chain delays have left multiple medicines including the antibiotic amoxicillin and Adderall in short supply, the reason for a lack of certain diabetes drugs is unusual. Doctors are prescribing them to non-diabetics who want to use them for weight loss. All these fall. I need it to stay healthy and not die. For the more than 35 million people who live with type 2 diabetes, the shortages have added yet another layer to managing an already complicated and costly chronic illness. They've also exposed weaknesses in America's use of off-label prescribing, which allows physicians to hand out drugs to treat a different condition from the one for which they were officially approved. When those medications are hard to find because of celebrity and social media hype, patients with diabetes suffer. Ozempic, known generically as semaglutide, is one of a class of diabetes drugs known as GLP-1 receptor agonists that have been around for nearly 2 decades. It was first approved in the EU in 2017 for use in those with type 2 diabetes. Ozempic mimics a hormone involved in appetite and eating, helping to stimulate insulin production and lower patients' blood glucose levels. It also often leads to them shedding pounds. Francisco Prieto, a family physician in Sacramento, sees at least one person with diabetes per week who is having trouble filling their prescription for Ozempic. Patients will call multiple pharmacies and drive around town to see if it's in stock, but some still haven't been able to get it, said Prieto, who also does advocacy work for the American Diabetes Association. Recently, one of Prieto's patients experienced a 3-week-long delay filling a prescription for Trulicity, a similar type 2 diabetes drug that's also seeing increased demand for weight loss use. Prieto prescribed a lower dose, and recommended that the patient take 2 injections a week. He described the compromise as less than ideal, but better than nothing. Without their medication, patients with diabetes could be at higher risk for things like heart disease, heart attacks, infections like COVID, disability and even death, Prieto said.